Hello and welcome to today's Lunch and Learn series presented by Kaplan. My name is Meredith Ashley. I'm a nurse education consultant here with Kaplan, and I'm going to be your moderator throughout today's presentation. Before we get started, I do want to point out a few features in the Zoom room. Feel free to comment thoughts, ideas, or any questions you have in the chat area for all attendees to view, and we'll make every effort to answer them. If our presenter can't, I will also try to help answer some of those questions. And then we'll also have some time at the end for a little Q&A session. So you can always unmute then or type your questions and save them for them. We will be posting a link for the evaluation survey. It's already actually in the chat, and I'll put it again at the end. Included in the survey is a certificate of your attendance, and we hope that you'll take a few minutes of your time to complete the evaluation of today's session because your feedback is very important to us. This session is being recorded, and the slides from today's presentation will be made available once the recording has posted. You can access the slides and recordings at the registration page, usually about 48 hours after the live presentation. Today's topic is on igniting engagement in your students, and so we've got a great presenter today. Julie Hamilton will be our presenter today. She is transitioned into the role as a nurse educator consultant in Kaplan after spending over a decade as a Kaplan NCLEX instructor, tutor, and content developer. With 29 years of nursing experience, Julie has served in many different areas of academia, including program chair, establishment of new nursing programs, developer of course curriculum, and an active faculty instructor for PN, ADN, and BSN programs teaching in the classroom, skills lab, STEM lab, and in clinical practice rotations. So Julie, with no further ado, I will hand it over to you.
Thank you, Meredith. Welcome, everyone. It's so good to see all of you here with us. I know you're super busy this week, and Meredith and I want to first say congratulations to those that may be graduating in May and all your hard work with your students. So let's go ahead and get started with talking about engaging nursing students for success. What are we going to learn today? What are our objectives? Well, we're going to talk and identify strategies for promoting active learning in nursing education, describe methods for creating a student-centered learning environment that empowers nursing students, explain the importance of and relevance of real-world application to enhance critical thinking skills. And that is really, really key. And we'll kind of dive into that as I go over the slides on how we can do that with engaging our actual students. So let's first talk about student engagement. What is it? Well, we all know what engagement is. We want students to be involved, but we want them to be participating actively. Now, there's several dimensions of that. When we think active participation, it's not just do what I say, read this, do this, watch this video, engage in the class discussions, but there's multiple layers that we have to look at related to engagement. Think about your own self. How do you get engaged? What tempts you to be engaged and motivated to be engaged? So we have to look at the behavioral side of things. We want them to do what we've asked them to do related to their learning activities. So this is more kind of step by step. Attend class, complete the assignments that I've given you. But we also want to look at the emotional engagement, that emotional investment. Think about how to spark and ignite your students. We do this on an emotional level. When we think about experiences that we've had, a lot of those experiences involves our senses, right? So when we're thinking about how do we motivate the student to engage, we need to think about piquing their curiosity. So what's their interest? Their enthusiasm, their sense of belonging in the community, in the class itself. This is important for them to become actively engaged and participate. We also want to think that cognitive engagement. How do we get the mind? How do we get the mind and that brain to say, I'm going to invest in this? We want them to think critically. We want them to be safe practitioners and making safe decisions for client care. This involves a deep processing of information. How can we tap into them? How do we get them to tap into themselves and to their brain and feeling emotionally safe? And then completing the behaviors we expect them to complete related to what we're giving them to do. So let's think about, what do we need to know as educators to help them become active participants? You got to know your audience. And your audience, when you're doing a presentation, you're doing a lecture, you're doing a lab, you're doing a clinical, you've got to know your students and you've got to understand them. So the NLN published a report in September of 2024 related to the average age of our nursing students. Now, we know our nursing students come into our program. It depends on whether we have a ADN, ASN, a PN program, a BSN program, whatever program we're kind of teaching in. Those students that are wanting to become an RN, the average age for about 3/4 of that population is less than 30. Okay, so when we think about we are educating those students that typically are going to be less than 30, what does that mean for us? Well, we've got to know them. So those students that are born from 1997 to 2012, age around 13 to 28, below that 30 age, they're noted for being the Gen Z. All right, now I don't like to label our students because they all have different ways they learn, and we know that. But let's tap in ourselves to understanding this particular age. They were born digital. What does that mean? This is the first generation that's been exposed to everything digital from the time they were born. What does that mean as educators? They'd rather tap into videos, TikTok, YouTube, than read your textbooks. Now, tell me in the chat, are you seeing a lot of your students not want to read your textbook? They just don't like doing it, right? Why? They're used to all the digital. And I want you to think about this as we talk about this perspective and as we dive into understanding the student population. We've got to understand they weren't raised reading, right? Good. The text is digital now. Excellent. Okay, they're not raised. No, maybe their parents read to them. Of course, their primary education, they had to read. But their mind is processing information digitally. That's what they've been exposed to. So how do we take that we want them to read, and how do we tap into how their brain works and processes? So even though we want them to read and we want them to do what we've asked them to do, they get bored with reading. They get very bored with it. They don't know where to start with reading. So we've got to understand that. They would rather watch that TikTok. They'd rather watch YouTube. Now, I went to a conference, and just recently, one of the presenters told me, in this generation of students, their attention span, and I've got this on this slide, I didn't say their attention span is small, because it's not. It's quick, very quick. We have about 8 seconds to grab their attention. Now, we look at that and go, whoa, 8 seconds. That's all I have to grab their attention. What does that mean for us? When we give them 100 pages to read, we're not grabbing their attention. They don't know where to go with that. Their brain is used to processing multiple things at once, and they can make decisions by inputting all that information in just a video. They can learn how to cook in 8 seconds. They can learn how to do all kinds of things in 8 seconds with a video. This is what we have to understand for this student population. They're used to blended education. Now, I want you to think, this is all about bulk of our COVID students. They did not have the option for online learning. It was mandated to them. We threw them in it. They didn't have any choice in it. So they're used to that online environment and that class environment. And we've got to understand that when we are educating, we need a mix of both. And I think we're all doing that. They need bite-sized information. Now, I didn't put chunking or that kind of communication with you. Bite-size, 8 seconds. So we need to give them the bites so they can chew it very quickly, input it very quickly, have meaning for it very quickly. And that's what we've got to understand. If we're giving them a PowerPoint up there and it's just sentences after sentences after sentences, they're not processing that. They're tapping out, not tapping in. Think about smart devices. They love apps. They're born with that phone and they love the phone, but here they're not using a phone like I did when I was young, using a phone to go talk to people. No, they're using a phone for all different things. They are communicating with others, which is good, but they're not communicating in our verbal type of way. When they text, they're texting in abbreviation form, not sentence form. So we have to understand that. They love apps for everything. An app keeps them engaged, especially if it's a well fine-tuned app. They're used to kind of being in their own space. They love personalized experiences. That's why they go to that TikTok. That's why they go to the YouTube. It's personalized. And they're used to being kind of isolated because this, again, is the COVID generation. But that doesn't mean they don't like community experiences. They're gamers. So those video games, I want you to think about it. And I've got 3 sons and they all love the games, of course. But when I watch them play, they are not only inputting everything that's on that screen and what's going on, and there's multiple things going on, but then they're popping up things so they can have new gear or new outfits. There's something going on the side, on the right of all this chatting that they're interacting online with other gamers. All this input is coming into them for them to make a decision on that game, to do whatever they're doing on that game. That's what we've got to tap into. They can process just all different modalities of learning and they can do it quickly, but we've got to tap into that, how their brain works. They love collaborative learning because when they're gaming online, they are working with others online as a team or individually. And again, all this information is flashing on this screen and they are taking it, they're processing it, and they're making a decision. That's what we have got to really understand, that they are amazing at taking input in and making decisions. We just need to know, how can we get it in them? Again, they have that quick attention span, and with that quick attention span, they love immediate feedback. Think about the gaming. When they're done with the game or whatever they're doing, they get instant gratification, whether they win, lose, or whatever game they're playing, they're getting instant gratification from that. They're getting instant immersion from that game as well. We have to understand that they have difficulty waiting for that feedback. They want it immediately because they're used to getting it immediately. Now, this generation, and my bottom prompt here is they require guidance. They know how to do all these great things and they know how to process multiple images and just things on that screen, but we need to guide them. And what I mean by guiding them, if you want them to read the textbook and you're giving them 50 pages to read tonight, you've got to guide them because they're going to look at that first page in that textbook and go, this is overwhelming because nothing's popping out at them. There's no imagery. They're not used to that. So guide them. So maybe you provide prompts to them. Within your textbook, maybe it's laid out in sections. So for this section, that title asks them a question. What is most significant in this section? What is the priority action in this section? We want them to be able to comprehend the information they're reading, not just read it because we've told them to read it, but comprehend the information and be able to apply this information. So that way, if you've got a pre-class assignment and you want them to read, you've got to guide them. Guide them. Prompt them with Socratic questioning as they're reading. Now, that takes a lot of time for us up front if we have a written textbook for them to do that, but there's going to be purpose and worth to it, and they're going to engage more in that activity of reading. We want to foster an engagement climate. The climate in your classroom is so super important. We want to respect our students and treat all students with respect and value their contributions. We know this, but how do we get students to understand it and how can we role model that? We want it to be inclusive. So we want to create a welcoming environment for all students, regardless of their background or their learning style. They all learn a little bit different. So that means for us, we need to mix it up. We want them to have solid routines. Absolutely. A solid cadence, pre-class assignments, in-class activities, post-class assignments. So it's full circle. But we need to mix up what those are because we need to constantly grab their attention, constantly be doing things differently. When we do the same kind of thing, it's a good routine, but they get bored with the routine. So we got to mix it up a little bit. We want to foster a sense of safety. I want you to remember these are COVID students, but they're also students that have lived in an environment in a setting that's felt unsafe. So we want to have that psychological safety where students feel comfortable asking questions and taking risk within our classroom. We want to provide support and encouragement to the student. We want to collaborate, encourage interaction and collaboration among other students, get them engaged with each other. And then, of course, enthusiasm. And that's the big one. Demonstrate passion for the subject matter. You have that salient information that they need to know. We need to get it in them. How we do that is showing them we're excited about the information we are teaching, the information that we're sharing. So let's talk about some active learning strategies. Now, with the active learning strategies and any strategy that you're utilizing pre-class, in-class, and post-class, I want you to think, we want the student to critically think, not just know the information and spit it out and understand the information, but how are we going to apply it for clinical practice, for them to practice safely as a nurse using case studies. Now, with case studies, I want you to go back to your own clinical experience. Those are the best case studies to formulate. Because you remember that experience, you can bring that emotional context in that experience of how you felt during that experience. Not what though we dive into our own experiences, but using that as something to engage them, to motivate them, to grab that attention. Simulation. Now we think of simulation and we generally think of simulation for clinical experiences. Or to, if a student couldn't go to clinical as a makeup type of thing. Or we think of simulation as just in the lab. Bring simulation into your classroom because it's structured as a clinical situation. So you may have a pre-class assignment where they have to dive into the chart related to a digital experience with simulation, a mid-fidelity type of situation. They have to dive into the chart and get the history. They have to do some assessment, physical assessment findings. And when they come into your class, then we can talk about what assessment data did you collect, analyze that data, and determine what are the problems in the client. And then the post-class activity could be related to evaluating the actions that you discussed in that classroom. So again, it's full circle. We're using the nursing process. Use the nursing process as a step-by-step guide in these experiences so they get used to that nursing process over and over and over with their thinking. They love those images. So infographics are great assignments to have them complete, and also great things for you to show and display in your classroom. I've got an example of that I'm going to display today. Microlearning. So think about those bite-sized learning activities, that bite-sized information you're giving them, chunking of information. If you're recording your lecture as pre-class assignments, I want you to think about chunking it. Not a whole half hour of everything you're going to cover in that class, but chunk it into organization. Maybe you're going to talk about Crohn's, okay? Have a 5-minute video, 3-minute video just on Crohn's. Then you're going to talk about ulcerative colitis. Have a 3-minute, 1-minute little snippet of ulcerative colitis. So instead of having 30 minutes of a PowerPoint lecture, have micro little videos. Concept mapping. Now, concept mapping and algorithms are fabulous. So concept mapping, there's some great free online resources where you can do this in class with them. They can engage in it. So what they are doing on their laptops can automatically kind of go right up to your screen. Show them how the connection and the puzzle pieces work together to formulate that decision that they need to make. And these are great assignments for them to do, but allow them to be creative in how they do it. Because you not only want to help with their learning and tap into that brain and to help them process, but don't take the creativity away from them. Allow them to be creative because they are amazing at what they can do. Some additional learning activities, debates. So we were talking about Crohn's versus ulcerative colitis. If you've got a class, break them up into 2 groups. One group, we're going to talk about Crohn's. The other group, we're going to talk about ulcerative colitis, and let them debate what's the differences. It's fun. It's interactive. They love competition. They love those types of things. Of course, we're going to have boundaries, and we're going to have rules related to the debates, but get them talking and engaging. Field trips. Now, this is kind of elementary. I'm bringing field trips in, but you have a campus that's right there at your fingertips. So when you're doing different things and you're wanting the students to explore, get them out of that classroom space and take them outside. Maybe go into a different department and interact with that department. Within your college, within your university, I want you to think, do you have an engineering department? Do you have a psychology department? Do you have a math department? Do you have a technology department? Tap into these. Role play. And what I mean by role play is role model collaboration with other departments. A lot of times nursing just stays in our little bubble. And we're not reaching out to these other departments that we have on our campus or our university. So think about field trips. Now, role playing is another thing. Now, role playing can be very, very exciting for students. Again, remember, they like images, they like those visuals. So get your other faculty involved in role playing, different scenarios. I've got an example of this a little bit later. And you can get the students to role play the patient, role play different situations. Think about escape rooms. Now, you may not have an actual room you can go to as an escape room, but think of the escape room environment within your own classroom. You can set it up where there's stations and students have to make decisions before they can go to the next station. So think about how you can engage them in that. They love solving problems. They're gamers. They love that competitive edge, but also being able to solve and reap the benefit of solving that specific problem. Think about think, pair, share. So give them individual questions. They have to think about it and then pair them up and have a discussion about it and then share it with your classroom. Think about a flipped classroom, having them provide presentations to the entire class. Now, it needs to be short and sweet, but have them do an infograph, not a PowerPoint presentation, but a quick infograph with links on it, things that they can share with each other that helps them engage. Let's think about technology and enhancing their learning. They love videos, so we include videos. You can play a little snippet of a YouTube video in your classroom and then have a discussion of it. Same way with TikTok. Interactive polls. There are so many free interactive polling out there, Mentimeter, Poll Everywhere. Bring that in. Bring that into your classroom and get your students engaged. Interactive quizzes. There's Kahoot out there. There's a lot of different free kind of quiz modalities out there and platforms. Discussion forums. Now, discussion forums, we usually preset these, right, within our LMS. But think about how you're asking questions. Get the students to engage with each other, kind of like that debate or role playing. So not just, watch or read this article and answer these questions, but let's think about that Socratic questioning. Why? Why was this research article important? Why do you think I asked you to read this research article? How would you use this as a nurse? These types of questions get them more engaged and involved than just saying, what was this and what was that? And those short-ended yes or no type of question. Use those open-ended questions to really get them to expand on the information. Online simulations, we talked about that. So get those pre-class activities, include that simulation within your classroom and do the post-class activity. Apps, they love apps. Now, when I talked about your engineering department and I talked about your technology department on your campus, collaborate with these departments. See if their students can have a project where they create an app and share it with our students and let our students collaborate with their students. Think about QR codes. They love it. They love information quick and fast. So develop some QR codes and use it in your classroom. Generative AI. Yes, let's use AI and give them parameters of using AI, when they can use it, when they can't use it, but bring it in your classroom and show how they can use it effective. Again, we need to role model how to use AI effectively. VR immersion, so that virtual reality, and even, an augmented kind of reality. Smart devices, phones, their watches, they love all of them. I know we want those smartphones put away during our classroom, but sometimes we need to bring them into play so they can see how they can learn from that smart device, not just use it. We have wearable blood pressure monitors, wearable heart rate monitors. Get the student engaged in that. So have them take their own heart rate with their smartwatch and then Have them take each other's blood pressure and see if it's validated. See if that number is the same. See the situation, and maybe they walk in, or they run in place for 5 minutes, and one, probably not 5 minutes, but a minute, and then retake that. Is it congruent? Are you validating that that information is true from that smartwatch or that device? Think of podcast. Now AI can take your lectures and turn it into a podcast. And students love podcasts. They love learning on the go, where they can hear it on their smart device anywhere, anytime. So think about using that technology. Robotics. Now we know we've got robotics within our simulation, right? Because that's a big robot within simulation lab. But think about how you can utilize that as a field trip. Let's go to sim lab and let's talk about this. This patient has a respiratory issue. So that's bringing that learning experience and that activity into real classroom experience. Holograms. Yes, holograms provide this 3D image. Again, if you've got an engineering department, you've got a technology department, work with that department. Let's see if they can make us a holograph, and have the student go around that 3D holograph and think about maybe the brain, or think about anatomy and physiology. We want students to understand physiology and pathophysiology, how that body works and how it responds to conditions and diseases, to understand those diseases that we're covering in class. Think about gamification. They love gaming. So think about gamification and how you can incorporate that into your classroom. And then don't forget, they love immediate gratification, immediate feedback. So provide things with rewards and how they can advance. So if they complete this case study and they do it successfully, there's bells, there's whistles, there's a badge, and they can go to the next case study. So really think about providing that positive reinforcement. Now, initially in your classroom, I want you to think, how can you engage them and how can you ignite that spark as soon as they walk into that classroom? Use what you have. Have music playing that pumps them up, that gets them excited. Do a random drawing as they walk into the class, and maybe you have pieces of paper in a fish bowl or just a bowl, and it's got different questions on what you asked them as a pre-class assignment, so you can start engaging them. As soon as they walk into your class, have an NCLEX style question on the board or projected. And instead of having them sit down, ask them, go ahead and put your things at your seat. Keep your cell phone there, your smartphone. But I want you all to remain standing, and we're going to play four corners. So if you like answer one, I want you to go to that front left right corner. If you like answer two, go to the back left corner. So get them moving as soon as they come in your classroom, especially if you've got an 8 o'clock class, they're asleep. Especially if you've got a class right after lunch, they're going to have food coma. So get them moving, get them interacting physically, mentally, emotionally, invested as soon as they walk into your classroom. An example of role playing in an escape room, I want you to think about a mental health course. All right. Find your actors. So let's role play. Now, your actors could be, maybe you have a drama department in your college. Bring those students in to be your actors. Maybe you have a psychology department. Bring those students in as your actors. Bring your faculty in as your actors. And you can have one of them acting as maybe a schizophrenic client, a bipolar client. They're all doing different mental health, depression, those types of things. And they're in different kind of stations. And they're doing different things in your room. Think about an escape room. So the students would have to go to the one client, that role-playing client, that actor, and they've got to decide what's going on with this client. What do I need to do for this client right here, right now, based on what I'm seeing? They understand that, they get that right, they get a clue to go to the next client, and then they've got to understand that situation. This is how you can involve the role playing in the escape room. And then we're discussing all the mental health issues. They're visualizing it, they're seeing it. You could do this also with videos or with images within the room itself. So set up your room, have them identify clues. You could have them in groups to collaborate to solve the problem and figure out the actions they need to take for that client. Or maybe they need to determine those safest outcomes, what would be best and most beneficial related to this client, or even therapeutic communication and interacting with that client. So this can be fun, it's involved. Now, the setup is going to take you a lot of time, just thinking about the organization, thinking about getting everything kind of together in place. But once you have it done and you have that learning experience, that forefront of all the time that you invested for this activity, you've got it for the next round. You've got it. So you've got to invest some time in just thinking kind of outside of the box, but it can be very beneficial for your learning experience. Think about a field trip. I always did this with the nursing process. When I was teaching the nursing process and fundamentals and foundation, I would take my students outside in the parking lot. And they didn't know anything about the nursing process, but I was getting them to understand assessment. And so I would have them each look at a car. Now, there has to be rules. They can't touch the car. They can't open the car door, those types of things. But they know cars. So I want you to assess this car. Now, maybe you don't want to go out into the parking lot. That's okay. Get a bunch of matchbox cars or hot cars or, those kind of things, and keep each one in class a car, or have visuals up on the screen and say, let's assess this car. Give me all the information you know about this car by looking at this car. You could do a holograph of a car, and you could have them walk around that car, and they all got to assess that car. Why do this? Because then we can really interact and say, let's analyze this information. Did it have a flat tire? What was the abnormals in the car? Was there a dent? Was there scratches? And then they go, oh, I didn't even think about looking at that. What color was the car? You can really start engaging them in something fun related to understanding assessment skills. And not just in class saying, here's the nursing process and here's the steps, but getting them engaged in that process early on. Here's an example of an infographic. Now, Meredith actually put this together for our nurse consultant newsletter. But look at this infographic. It's visually appealing. There's different little links. Have your students start engaging in this. There's free applications out there that they can start using these infographics. Use them for your class activity. So I want you to read this. I want you to go here. I want you to watch this video. These infographics can give something different than just a course outline of what we're going to do each day. Have an infographic on what they're going to learn and what you expect them to do pre-class, in-class, and post-class activities. It's fun, it's exciting, and get them engaged in it. Once we've got the learning activities in place, don't forget to evaluate their effectiveness. Are they working? How effectively am I engaging my students? What strategies am I using, and are they really working? How can I improve to get to better meet the needs of these students? Get feedback from your students. What did you like? What you didn't like? How could we change it up a little bit? They know what works for them, so get the feedback from them. Engage in professional development activities to enhance your teaching skills, and lean in and collaborate with other departments and also other universities. Maybe you can't do a hologram. Maybe you can't do an app. Well, maybe there's a university beside you that has that type of capability in that program. Educators really collaborate with other educators, share ideas, because that's just going to make us all stronger and better and help to prepare our future nurses for their future. Because AI is going to be in their future. All of this is going to be in their future. We need to grab hold of it and start utilizing it in our classroom. I know I went over a little bit, but I hope this information was helpful. Do you have any questions? Did you all stay with me or did I lose you? If you've got any questions, place them in the chat. Oh, good, Sarah, good, Tara, I'm glad you enjoyed it. You're welcome, Leslie. Don't forget to fill out the evaluation. It's quick, it's easy, and you get your completion certificate. Yes, Leslie, great question. You will, it usually takes about 48 hours for our team to kind of put everything together, but it will be right where you registered. You will be able to review the video and you'll also have the PDF handouts of the PowerPoint slide. You are so welcome, Yvonne. Hi, Glenda. Great to see you, Glenda. I'm glad you loved it. Yeah, Sarah, and we do kind of understand it, but like I said, and I've kind of said this before, let's tap into it. Let's really watch them. How do they learn? How do they get engaged? What motivates them? What gets them curious? And really use that to our advantage to help them. Well, it's like we don't have any questions.
You did a great
Yes.
job.
Yeah. Dr. Lisa, yes, you're going to have to maybe work with your engineering department. There are some there, and I know I say this, we don't want to tell our students this, but Google it. There's some great information, and within my actual references, I'll have an article that you can check out too, which gives you some really great information. But yes, so to develop that hologram, we need also to kind of develop ourselves on all this different technology, but reach out to your colleagues at your university or colleagues that have done this. They can actually do a hologram with their smartphones. So that's what my article will have in it, in the references when you get the slide deck. So yeah, check that out. You are welcome. And invest time with, different departments and their students. They would love to give them a project for the nursing program. And, we're role modeling the behavior to collaborate with the interdisciplinary team. Good, Elaine. I'm glad it was helpful. All right, it looks like we don't have any other questions. So we hope you have a fabulous day. And if your semester is ending, we know you're very, very busy. So we appreciated your time today. We appreciate all that you do. And congratulations to those graduates that are graduating in May. And reach out to us anytime. Oh, spice it up, Elaine. You can spice it up. Yeah, use some of these. You can do that. All right, we're going to go ahead and close our room. Thank you all. Have a great
Bye-bye.